Hi guys, welcome back to my channel. Thank you so much for joining me today. If you are new here, my name is Ora. I'm a pharmacist licensed in Canada and the UK.
So for one reason or the other, this part of the video did not record. So what I'm trying to say here is that I have a guest on my channel. His name is Owens, and he'll be talking to us all about his dental journey as a pharmacist. Enjoy.
Thank you so much for joining me today, Owens. So yeah, if you want to tell the people a little bit about yourself, what you do.
Thank you for having me, first of all. My name is Owens. I am a duly qualified dentist and pharmacist. I'm currently working as a dentist in the hospital.
I guess many people don't see this. So this is one of the reasons why I wanted you to come on the channel, because it's not something that we see commonly where you have someone who is like dual trained.
Mhm.
Usually we see like maybe like doctors who used to be pharmacists. I've heard of that, but
Yeah.
you went into dentistry school. So
Yeah.
yeah, how did you get into that? And what was, first of all, actually, what was your journey into pharmacy? Because pharmacy was the first career that you followed.
Yeah.
So how did you get into that?
In essence, I've done the sort of usual pathway that you would for any sort of undergraduate application. So I went through the sort of UCAS system.
Hmm.
And then I graduated from UCL. So I did my sort of 4 years there. I sort of registered as a pharmacist after my pre-reg years, which you have to do in the UK. I also did that in hospital. In terms of what got me to do pharmacy, so it wasn't my original choice. I think both from like sort of my parents and I suppose my school as well. The sort of medicine was always the thing that it's always sort of thrown at you as the first option. I suppose I spent a bit of time looking into medicine, so doing work experience, doing shadowing, and applied a couple times to get into medicine. Unfortunately or fortunately, I didn't get the place. I sort of, let's call it, stumbled across pharmacy because it was not, again, something I looked into. Through that, I just made the application as my fifth option into sort of doing pharmacy. And yeah, I'm praise be that I've managed to get a place, and yeah, that's how it sort of all started.
Something you said that maybe some people might not be super familiar with, because even when you just said it, I actually just remembered. You mentioned pharmacy being your fifth option. So can you explain a bit about what that is? Because some people who are not, maybe don't go to med school in the UK, may not understand what
Yeah,
fifth option is.
when you come to apply through UCAS, as far as I'm still aware, is still the case. You are allowed to apply to 4 medical schools or 4 dental schools, for instance. And then you can have an extra option, which is open to any other course. And you can normally, when it comes to doing healthcare options, so normally if you're applying for something like medicine or dentistry, you can put any option you want, really, but it's probably something that you'd want to match with your personal statement, and therefore it sort of lends itself to be a sort of healthcare profession.
Yeah, that actually makes a lot of sense, because we only get to write one personal statement. So obviously you can't have like, pick 4 medical schools and then maybe in your last one you want to do like arts and craft or something. Like it has to
Yeah.
obviously be something related. So you get into pharmacy, you obviously finish, you do well. And how many years did you work as a pharmacist? Well,
That's
okay, that's
an interesting one,
how many,
actually. Look,
how many years did you work as a pharmacist before you went into like dentistry?
the answer is zero, really,
Oh.
because I applied to dental school during my pre-reg year. I suppose one thing about me, I always find I like to be very well prepared. So I always like to have like an option B open in case my plan A doesn't work.
Okay.
There was a job that I was almost exclusively looking at when I was applying, as a sort of band 6
Yeah.
pharmacist.
Yeah.
And I just thought that, in case this doesn't sort of plan out, what do I do?
Mm.
And again, I started like looking at all the options. I mean, to be honest, I was looking mainly first in, different pharmacy roles and different
Yeah.
pharmacy positions. But I think I probably went a bit overboard, and I sort of looked at with that as well.
Hmm.
And I again sort of revisited the idea of doing medicine.
Mm.
Um, thought about that quite sort of long and hard.
Hmm.
I then thought, I think at this stage of my life, being a bit sort of older, I'm not sure I would be so keen on sort of doing the things that you normally associate with junior doing so a junior doctor role,
Yeah.
like long nights, weekends, and that sort of lifestyle. So
Mm.
although I think in my head I thought, oh, medicine would be the ideal thing, I was looking for something else. And by chance, somebody in the year above me did the same jump as me, so actually went into dentistry.
Dentistry. Wow.
That just sort of made me think more than anything, really. As I, this could could be something quite
Yeah.
interesting. I was watching a documentary on
Mhm.
it was about a charity called um it was called Mercy Ships,
Okay.
and they do and there was like a maxillofacial surgeons on it,
Hmm.
who was treating cleft lip and palate patients, or like children. And that really was so inspiring for me. I was like, you know
Mm.
what, like this. And I knew from there that you had to be a dentist as well. So I
Okay.
think that's where I sort of looked into it. I said, maybe this could be an option. I think something that really helped me was actually being a pharmacist. I felt very comfortable. I felt like I could jump from a very comfortable position into
Yeah.
the unknown,
Yeah.
because I
Yeah.
felt like the worst case scenario, it's a
Going back.
no. And
Yeah.
actually, I've got something really good to sort of
To
land
fall back
on,
on.
which
Yeah.
is
Yeah.
my original profession.
Yeah.
It certainly helped me a lot in terms of you know taking the risk. It all just happened naturally.
Mm.
I would say, so much so that I never had the chance to even look back.
Like you've mentioned a couple of things, and I don't want to go too deep into kind of like the ins and outs of dentistry, but more like the fact that you took, as you said, you took a leap because you knew you had a fallback. I wanted to kind of like you to walk us through just how pharmacy helped you even when you were in dentistry school.
Mhm.
And even now, like, do you kind of like waffle between pharmacy and dentistry, and how is that, having that fallback, which it's not a fallback for you
Yeah,
now anymore, but
yeah, yeah.
at the time, how did that kind of support your goal that you were working towards?
I think being a pharmacist, I always see it as a sort of my ace in my sleeve. When I was in dental school,
Mm.
I found that I think realistically, like the sort of knowledge that a pharmacist has to keep in their mind and how to study, it's a lot harder than when it comes to doing dentistry, because we're, at the end of the day, we're learning pretty much every body system and the physiology of that.
Yeah.
I found that actually helped a lot when it came to sort of doing the human physiology, and
Yeah.
again, really understanding teeth, which at the end of the day is just a part of the whole body.
Body.
There's something else that's really helped me, and I always see it now, actually more so than before, is how almost like second nature it is to me, for me to sort of like rely on the sort of communication skills, the
Mm.
sort of teamwork and the professionalism that you
Yeah.
learn in pharmacy to
Yeah.
manage my sort of dental career.
Yeah.
For example, I find that as a pharmacist, I can see the bigger picture in terms
Mhm.
of looking after someone's oral health, because
Yeah.
I really, like with pharmacy, when that for instance, like adherence with a treatment
Yeah.
might be not necessarily, especially long-term treatment,
Mm.
it's not necessarily something that all patients will do to the letter. It really sort of brings me back, even with, when we talk about dental treatment.
I think it's one of the, as you said, it's one of the skills that I feel like you do learn in pharmacy, because we spend so much time working with the patients.
Yeah.
So learning that empathy, being able to put yourself in their position as well, is really important. The other part was just like how like your knowledge as a pharmacist helps in terms of prescribing.
Yeah.
Some people, I guess this is just UK specific. In Canada here, we don't have, I don't think we have, I've never come across a dental formulary or anything like that. But obviously in the UK, one of the things as a pharmacist that you're looking for when you get a prescription from a dentist, is it on the dental formulary? Can the dentist prescribe this? So do
Yeah.
you think that your knowledge as a pharmacist helps with just knowing what I'm allowed, not allowed to prescribe, and how it should be written, for example? I'm sure you probably don't get many calls from pharmacists saying, "Oh, you haven't put the notes."
I'd hope so. I'd hope so.
Yeah, does that help? Like clinical wise, does it help being a pharmacist?
Yeah, I mean, absolutely. And I think it's sometimes I mean, first of all, yes. I mean, I've been at the other end
Yeah,
of the prescription.
yeah,
So I know what helps a pharmacist when, having even just something as simple as clear handwriting. So I know this, and knowing that, my handwriting could have a big effect on
yes,
how it's read, and how I take extra care to do so, or, just include all the details that can be useful, write in the clear direction.
So we spoke a few weeks or maybe a few months ago, and you mentioned about obviously like with during the pandemic and being able to use your pharmacy profession in terms of working, but also like dentistry. So do you still do that at the moment? Are you licensed kind of on both ends still? And do you do like weekends where you work in like Lloyd's pharmacy?
Yeah.
Do you kind of use that kind of balance between the two?
I must say that I've probably, I mean, as of sort of this year, I've sort of started sort of winding down my sort of community pharmacy role that I used to have, because I just find, even just for like some work-life balance,
Yeah,
it's so important to really focus on. Yeah, I mean, it's good to make money and like
yeah,
use both skills, but at the same time, having that bit of time off is so important, I find. In terms of my clinical, my sort of community role, I've kind of stepped it down quite a bit, also because I'm in a hospital role, and I'm expecting to start doing like nights and on calls. So I find that although it would be nice to keep both things going, I'm just needing to really you know decide. And I think
yeah,
at the moment I'm really trying to focus on getting the sort of dentistry, the sort of getting up my skills in sort of
dentistry.
dental part.
Yeah,
So but yeah, I suppose something that you weren't talking about this, or the time during the pandemic, for
yeah,
me it was a strange one, because when it hit, I was in my final year of dentistry. So I wasn't qualified or I wasn't registered as a dentist yet. But I remember like, our university finished a little bit sooner, and there was, desperate need for pharmacists, especially here in Scotland,
yeah,
where, it was just quite desperate. I mean, I remember to the point that throughout the UK, they asked people that are retired or stopped working as
to come
pharmacists
back.
to come
Yeah,
back on the
yeah, I used to
register.
get those emails. Yeah,
Absolutely. So like, I remember when, when the chance came, I said, no, do you know what? I mean, I'm still registered, and, I will go back and, play my role, play my part. And it was quite interesting, because obviously there was a lot of people who were suffering from sort of dental problems.
yeah,
And, given the fact that there was no open dental practices, or very limited access to dental treatment, knowing what I knew from my course, I was able to kind of give some advice, or useful advice, about how to sort of manage it, even with sort of the painkillers, saying,
yes,
the type of painkillers to use, or even to the point where I remember there was a point where we ran out of temporary filling
Oh, wow.
material in the
Wow.
pharmacies. It was just so short. But I
Wow.
knew from my dental colleagues, or there was people that that there was a point even they to sort of do with some sort of temporary cover. You
Yeah.
used to use the red from a baby bell,
Oh my
so that the
God,
wax, yeah,
really?
to just cover the hole. And
Oh
I
my
remember
God.
like there was points where I was like, do you know what? I understand there's nothing here weird, but just try to get some of this. You might be able to like at least like cover the hole that's
Yeah.
making that's making the area really sore.
Yeah.
And yeah, I think it was quite interesting because like a lot of my pharmacy colleagues really appreciated that
Yeah.
that
Yeah.
help, because I think in pharmacy school, dentistry is not really taught at all, or
No,
very
exactly.
well at
Yeah.
all. Yeah,
Yeah.
you
That's a part
almost
of the body
like,
that we don't go over. I mean, we talk about like ears and stuff, even with like
yeah,
ear
yeah,
infections, but we don't
yeah.
actually touch on. Yeah.
Yeah, so it's very interesting that it's probably an area where maybe there should be a few more of us that have
Yeah.
grasped to sort of like start bringing in this like knowledge between the two
Integration. Yeah.
professions.
Yeah. I think I kind of want to like, based on some of the things you said, like just speak
Mhm,
to, pharmacists who might be in positions where they want to try something new.
mhm,
I think this is something I've seen across the board, both here in Canada and in the UK. Like as pharmacists, we tend to be quite scared to try new things. For you going into dentistry, that would have been a completely new territory. So what would you say to pharmacists who are trying to just they want to do something different, but it's kind of that fear factor, but they want to
yeah.
try something new, but they just don't know, like, so what's your, like, how do you go about that, and how do you kind of approach those kind of situations?
It's difficult to sort of give advice in a way, because I suppose you really need to learn, you really need to know, you know, a little bit more about a person to tell you, yes, I think this
Yeah.
is why you should do something. But
Yeah.
having said that, if you have the sort of same personality as me, like where I think I actually like the sort of challenge. If you want to try something, you just need to go for it. And
Yeah.
I think like myself, um, realizing that, for instance, as a pharmacist, you have a really good background of
Yeah.
both knowledge that you may not realize, and also you've got a lot of respect that maybe people don't realize. There's a lot of opportunities that you can go and have as a pharmacist. Yeah, I mean, it's all about taking risks. It is all
Yeah.
about taking risks. I
Yeah.
think in areas where you don't know, you might be the first person doing it. So maybe there's even less of a chance of going wrong.
Yeah.
Maybe ask around, because you never know. Like myself, I found by chance there was somebody that did it before me. So sometimes it's always worth just reaching out to people.
Yeah.
I'd say take a risk,
Yeah.
reach out,
Yeah.
just get as many positive people around you.
Yeah.
That's another thing as well.
Yeah, I think just adding on to that, to what you said, I think obviously reminding ourselves of what you said at the beginning of the video, you already have a solid fallback. If you are already a pharmacist, there is that solid fallback. And even with pharmacists like myself who work in hospital, for example, we always chip in once in a while to community, because we know it's kind of like a fallback and kind of a way for us to make extra money. So it's pharmacy is a great solid fallback for all of us. So taking that risk, and as you mentioned about reaching out to people, mentorship is so important. And it doesn't even have to be like ongoing, just like having a conversation, or even just doing research to see who's out there who's already done it. I think
Yeah.
that's quite important as well. So I had two final questions for you as we wrap up. The first one is just with regards to money. So I know this is something people probably going to want to know. On what side is the money better? Is it the pharmacy side or the dentistry side? I think I already kind of know the answer, but
The simple answer will probably say dentistry, there is more chance of, earning more.
mhm.
It really depends on what type of dentistry you do,
Yeah,
where you work, how you work, and also maybe also the stress that you're putting on yourself. Like with dentistry, uh, you've got more potential of the sort of private of doing
Yes.
private work,
Yeah.
which I suppose is not necessarily available
Pharmacy.
in a pharmacy, because pharmacy is more or less NHS.
Yeah. Yeah. Yeah.
I guess with dentistry, there's probably more scope to go higher
Yes.
because there's probably more, it's a smaller sort of cohort of like dentists as opposed to pharmacists.
Pharmacy. Yeah.
So
Yeah.
there will be more like turnover of like jobs, I would say, like,
Yeah.
as people retire, there's more jobs going up. But yes, I'd say like it depends. If you're in hospital, I suppose it's quite similar.
Mhm.
In community, on the other hand, so you're a high street dentist, yes, there's a lot more scope to make your practice your own. There's a lot of scope of doing a lot of private treatment.
Yeah.
But at the same time, with that comes with the sort of extra earning comes, I suppose, more stress, probably more, you
Taxes.
really need to upskill yourself if you want to
Yeah.
do it properly.
Yeah.
And courses are very expensive.
Mm.
Insurance or indemnity is very expensive.
Mm.
So it's a bit of, it's a sort of
Weighing
balancing
up.
act. And
Yeah.
certainly, what you want to do, can really determine how you
How
go
much?
with your role. Most dentists in high street are self-employed. So
Mm.
you're really relying on, your earning is to do with how much you
You work.
produce or you
Yeah.
work.
Yeah.
So, in a way, you could find yourself in a position where, say, if you're not working, you're taking time off, you're not earning. As opposed in a different setting as a pharmacist, again, it can be quite the same if you're doing
Yeah.
like just locum roles.
Yeah.
But at the same time, if you're employed, you may find you've got that security of a
Yeah.
job,
Pay.
that
Yeah.
even with, if you're sick or if you're taking
Yeah.
holidays, you have that
Mm.
that security. So yeah, it's more complicated than yes and no, but it's
Yeah.
certainly, there is more potential of higher earning.
Yeah. Last question is, how can people reach out to you? I know that with my videos and how they go up, people sometimes, want to know, how can I get in touch with this person? I always recommend for people who see the videos to actually reach out to the individual. So yeah, how can people reach out to you? Do you have a space where they can like connect with you
Yeah.
if they have more questions?
So I've got a LinkedIn page, so it'll just be my name. Happy to reach out
Yeah.
on there. I'm quite happy to, answer any questions if anyone has any.
But yeah, thank you so much for taking the time. Yeah, it's been a really
Right.
insightful conversation, and yeah, it's helped me. It's inspired me as well to just try things and just challenge yourself sometimes, especially if you have a solid fallback, and especially if you're in a position where you don't really have so many commitments yet in life. I think it's important to just take a challenge,
Mhm.
take a leap, and try something new. Thank you guys so much for watching. But yeah, thank you. I really appreciate it.
And thank you for having me too.
Thank you.